health focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the causes unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist, Dr. Shareefa Isa Chause, live from the Nirmaya Hospital, Maitri Park, Chembur East, Mumbai. She will educate us more about urticaria and its management. Dr. Shareefa Isa is a consultant dermatologist and venereologist, specialist practices at Apollo Spectra Hospital Mumbai. And it's a pleasure to have her with us. She is from Nirmaya Hospital, as we have already told you, and it's a pleasure to have her with us. A very warm welcome to you, Dr. Shareefa.
Thank you. Thank you.
So, Doctor, as today we are talking about urticaria, first of all, we would like to understand what is urticaria.
So basically, urticaria is like a raised erythematous patches on the skin. They become sometimes swollen, and it is associated with a lot of itching. So they can occur in any part of the skin involving the mucous membrane, like the oral mucosa of the skin. So basically, this is all about urticaria. We can consider it as an erythematous patches, which are like swollen. So yeah.
Okay. Now, normally, whenever we have rashes or anything related with our skin, any kind of allergy, we normally see rashes, redness, etc. How can we differentiate as a layman between, what's happening on our skin as urticaria or any other kind of skin allergy, doctor?
So the patient of the urticaria, they come and they say like, ma'am, we have like then bumps आया था and then after certain time वो सब चला गया है. They are like very transient. Urticaria lesions are very transient and they are migratory. So कभी यहाँ पर आ गया, कभी वहाँ पर आ गया, and they subside after like a short period of time. But other skin disorders, they will not go. So they need a treatment and later on they go. But urticaria is like it comes and it goes. So it's like we can consider as like a transit. It is a transit condition.
Okay. And what are the main causes responsible for urticaria, doctor?
So there are many causes for the urticaria, like food, medications. Then there are like infections. Food we can consider the most important is like milk, eggs, peanut. Then medications are like NSAIDs and antibiotic. Then infections are like parasitic infection, respiratory tract infection, then many more, like pollens from the plants. Then latex, some people do have the latex allergy, and some people get allergy like chronic urticaria because of some autoimmune diseases. So there are many more.
So a number of causes can be responsible for urticaria, and many times the causes is untraceable or it's unknown. Does it make it more difficult to treat?
We cannot say it's difficult to treat because acute urticaria is like I said, it's a transient and it will last for only 6 weeks. Okay, that's the ideal period for the urticaria. But yeah, acute urticaria are like quite simple to treat. But for the chronic urticaria, it's like the treatment is quite guarded, and we have to treat the internal disease for that. So I can say, yeah, the chronic urticaria are very difficult to treat as compared to the acute urticaria, but it's not that much difficult to treat.
Right. And as doctor, you just mentioned about acute and chronic urticaria, we would like you to shed more light on them. What is acute and what is chronic urticaria?
So acute urticaria is like a benign condition. It's a self-limiting disease. It occurs independently, and sometimes it leads to the more more severe clinical manifestation like anaphylaxis, anaphylactic shock. But acute urticaria is completely curable disease that lasts only for 6 weeks, and chronic urticaria is like some it's a chronic urticaria lasts for more than 6 weeks, and it occurs because of the internal diseases in the body like autoimmune disease, then systemic lupus erythematosus, many more connective tissue disease. And to treat chronic urticaria, we have to treat the diseases, internal disease.
The treatment will become more easy.
Yes.
Okay. And doctor, how serious can urticaria be? Is it a life-threatening condition, something like that?
Yes, urticaria is a life-threatening condition, but it's not that much serious. Like I said, it can be treatable by taking proper medications. But sometimes when it's get converted into anaphylactic shock, anaphylaxis, then it's like a life-threatening because that leads to the swelling in the throat and that leads to the very difficulty in breathing. So yeah, sometimes urticaria is like life-threatening condition.
But that's very rare.
That's very rare. Actually,
Okay.
that's very rare.
Okay. What are chronic urticaria hives? Though you have already explained that the urticaria can be acute or chronic, but with chronic, as you also said, the treatment can take a long, long, long time. And normally the patients will keep on asking, are they going to go away forever or not? Because it needs a lot of patience, to go through the lengthy procedure of treatment. So what's the answer to that? How will they go away, the chronic urticaria specifically, doctor?
Like I said, it occurs because of the internal diseases. So uh, eventually all urticarias go away, but we have to treat the causative factor. That's the most important point in the treatment. So it's not like that it will be it will last for all over the life. We can treat the chronic urticaria, but need to figure out the cause. What is the cause of the chronic urticaria? And then we will go according to that. It's treatable condition. It's not that much. It's not like that it will last long or something like that.
ओके जैसे डायबिटीज या हाइपरटेंशन ब्लड प्रेशर के लिए कहा जाता है इनकी दवाइयाँ हमको जिंदगी भर खानी पड़ती है अगर हम ये दवाइयाँ खा रहे हैं तो मेनी टाइम्स पीपल आल्सो अज्यूम कि अर्टिकेरिया के साथ भी ऐसा ही है अगर क्रॉनिक अर्टिकेरिया हुआ है तो हमें लाइफ लॉन्ग उसकी दवाइयाँ खानी होंगी इज दैट ट्रू
Not lifelong, but for a certain period of time, we have to, like, patient need to have to take the medicine continuously. After that, we can lower the dose. Like I said, कि like हम positive factor treat करेंगे तो that will gonna subside, and then उसके बाद हम धीरे-धीरे medicine taper कर सकते हैं. It's not like that कि that patient has to take the medicine for the whole lifelong. It's not like that.
Okay. And doctor, what are the potential complications of urticaria if left untreated?
Complication, like I said, there is an anaphylactic shock, then there is a urticaria pigmentosa, then there is urticaria vasculitis. These are certain kind of condition that urticaria after certain period of time get developed. So but urticaria pigmentosa and like urticaria vasculitis are quite treatable conditions. But anaphylactic shock, we need to take some precautions for that because if there is any swelling, we need to educate the patient regarding that. If there is a swelling on the face or there is a swelling on the lips, around the eyes or around the throat, then what they have to do. So we just need to give them some education regarding that. So these are the most common complication of urticaria.
Right. We have seen many a times people will get swelling on their face, on their eyes, on their lips, and
Yeah.
that you are saying could be one of the complications, right? Okay.
Yes, yes.
And in case a patient or a person is suffering from that stage of or that type of urticaria, what he or she should know or what he or she should be aware of it. I mean, in case of emergency, what others who are, closer to those persons, those patients should understand about urticaria.
Okay, so anaphylactic shock is a very life-threatening condition, and the patient, if the patient is having any history of the anaphylaxis to particular substance, then they must be having some intramuscular adrenaline injection because adrenaline injection are the ideal treatment of choice. There are many pain injectors are also available on the market, so they can give them, the relatives can give them to the patient. SOS, like they're having any anaphylactic shock or something like that. And the baseline monitoring is important. Like if the patient is having difficulty in breathing, then CPR should be given, and the pulse and the BP monitoring should be done. So these are like basic, like pre-hospital care the relatives can give to that patient. And SOS antihistamine and oral steroid should be given.
Right. Now, the thing is, doctor, that we all know that in India, in our society, going to a chemist shop or buying, medicines over the counter is very, very easy. It's very convenient in a way. Now, many times people know that, okay, I'm having these allergies, so
Mhm.
due to allergies, I'm having these rashes or urticaria. So even if they are not aware of what exactly the condition is, they know that it's allergy. They'll go to the chemist shop, ask the chemist wale bhaiya कि मुझे कुछ एलर्जी हो रही है स्किन पे कोई एंटी एलर्जन दे दीजिए. That's a very typical line that we often use. And we start taking those anti-allergies. I'm sure you also get patients of urticaria who have done all these. Now, my question to you is, doctor, is it a safe practice to do so?
Is it the same?
Is it safe to do so, to buy anti-allergens over the counter and start self-treatment?
Because pharmacy people don't have such a kind of idea about every antihistamine, but sometimes they know like the levocetirizine is the medicine of choice. So like whenever the patient comes to them, so they give them the basic levocetirizine tablet. But like I said, like there are types of urticaria. So some will respond to the levocetirizine and some needs some extra medicine, like apart from levocetirizine. So yeah, I think it totally depends on the pharmacist's knowledge that what he's giving. Because many of the time I have seen my patient, they took levocetirizine and they said कि like हमने pharmacist से पास से लिया था, तो that's the thing.
So that's okay if for an emergency or we are going for that for a day or two before we go and meet a qualified dermatologist, right?
Yeah, that totally depends on the knowledge of the pharmacist, I can say, because basically, yeah, okay, what they are given, we don't have any idea like वो क्या दे सकते हैं क्या नहीं. So, but 90% में देखा है so like levocetirizine they give to the patient, that is okay, I think. But basically,
Right.
they need to consult a dermatologist. For levocetirizine is not the only drug of choice for the urticarial treatment.
एग्जैक्टली इसीलिए बहुत जरूरी है कि अगर आपको अर्टिकेरिया हो रहे हैं तो आप एक डर्मेटोलॉजिस्ट को एक क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाइए. I'll also keep on taking some of the questions that our viewers are asking. Suman Yadav is asking, what infections can cause urticaria?
So Suman, any kind of infection can cause urticaria because you never know which precipitant or which aggravating factor your body consider as a foreign body. So like the parasitic infection, upper respiratory tract infection, fungal infection, bacterial infection, any kind of infection, if your body consider it as a foreign body, it will start reacting to it.
Right. So Suman, I think you have your answer. Rita Jha is here asking, can urticaria be prevented naturally?
Naturally, there are no certain kind of like remedies that can be controlled, like that urticaria can be controlled naturally. Because urticaria is something which is like very like it's a like internal process, like the chemical vasoactive substance are released from your cells, and that needs to be controlled, and that is like the oral medicine are quite effective for that. Naturally, there are no such kind of remedies that urticaria can be controlled. If you want to do something like, then just notice some triggering factors and just avoid that stuff. That is the only best solution at home.
Right. So if something is triggering, you know what is the trigger, then you can avoid it. That's the only thing you can do without the help of the doctor. But anyways, you need to go and consult a qualified dermatologist. And as Rita has asked this or raised this question, doctor, because it's a very common, phenomenon with most of the people in our society. Whenever we have something, especially with our skin and scalp, we'll go and try to do some quick fix with the help of dadi ka nuska, nani ka nuska. We'll try to do some home remedies, and that's what we normally do. Then we'll ask our friends or family if they have encountered any such things. We can even go with their prescription, but we land up in front of a qualified dermatologist or a doctor after a very, very long time when all the what we have tried has failed. That's when we go and consult a dermatologist. तो ये जितना वक्त हम जाया करते हैं होम रेमेडीज में या फ्रेंड्स एंड फैमिली से कंसल्ट करने में, सबसे पहले तो क्या ये वर्क करता है और अगर नहीं वर्क करता और डॉक्टर के पास हम लेट होते हैं, तो क्या फ़र्क पड़ता है?
Like for urticaria, like acute urticaria is a transient. तो अगर वर्क नहीं करता है तो like eventually आएगा जाएगा when you go for food जिससे urticaria होता है.
हुँ,
But
हुँ।
chronic urticaria उस पर is like थोड़ा लेट ज्यादा लेट नहीं होना चाहिए because that is something which needs a treatment urgently, and anaphylaxis is like quite like it's quite serious condition. So I can say कि like late ना हो तो better है, and then there are no, like I mentioned, there are no such kind of home remedies to treat urticaria. So better if you want to do something at home, like I said, ki, like avoid the precipitating factor. Just notice like when you eat something, when you take something, or when you go out, is it affecting your skin, or is it like you are getting itching because of that? So you can avoid such kind of stuff basically.
Fair enough. We have Kajal Deshmukh with us asking, does any vegetable or food item should be avoided in urticaria?
There are no such kind of like vegetables or foods that is like particularly we can say कि इससे हो रहा है. But the books are mentioned like many causes, like many common causes are like eggs, milk, chocolates, cakes, then fish, then these are the like basic peanut. I think these are the basic food जिससे maximum cases आए हैं urticaria.
हम्म। आम तौर पे जो ये आपने लिस्ट बताई है, सी फूड है, एग्स है, चॉकलेट्स है, बहुत सारी चीजें हैं, हम सबको पता है कि कई लोग इनसे एलर्जिक होते हैं। ऐसे में कई बार हमें एलर्जी हो ना हो, हम एक ब्लैंकेट लिस्ट बना लेते हैं और हम उन चीजों को अवॉइड करने लगते हैं। सो इवन इफ I don't know whether I'm allergic to any food items or not, or I have not suffered anything like that. But still, I'll avoid eating. Okay, seafood से एलर्जी होती है तो ये नहीं लेना है, egg से एलर्जी होती है तो ये नहीं लेना है, and many people do that, you know. So again, is that a good practice, or we should not do that because ultimately we are omitting a lot of nutrients from our thali then?
You can do a regular basis पे एक exercise का आप एक chart बना सकते हो. So उसमें कैसे रहेगा कि like just whenever the episode come, you just mention it on the notebook and just notice कि like जहाँ पे episode आया था कि आपने morning से लेके evening तक क्या क्या आपने intake किया था. Then just आप एक एक चीज cut करके उसमें से देख सकते हो. It is not necessary कि like आपने हर चीजें avoid करनी, like when you are getting allergy to seafood तो like आपने ये भी नहीं लिया ये भी नहीं लिया. It's not the solution. Okay. So basically just जब भी एपिसोड आता है just make a note of that कि like morning से evening तक आपने क्या intake किया है, and just उसमें से एक एक thing आप कट करके देख सकते हो. That is the like best that is the best practice you can do. So it's better
Right.
because आप इतनी सारी चीजें avoid करोगे there must be nutrition deficiency and then दूसरे problems skin के problems start हो जाएंगे. So it's not needed actually.
Exactly. So it's not needed. You can maintain a diary. Plus, do go and consult a qualified dermatologist. That's really important to understand what is triggering urticaria, or is it acute or chronic, etc., etc. Now, we can understand, doctor, as you said, that urticaria is these rashes where they itch a lot, and the person who's suffering from urticaria can actually go through a lot of stress, because many times such people, they avoid going in social gatherings or in public because they want to avoid, you know, those uncomfortable or embarrassing situations. Now, can this stress aggravate their condition?
Yes, definitely, because stress is one of the factors that aggravate urticaria. And see, urticaria is not something which is contagious, so it will not spread from person to person. So there is no point like to think about that why I am going out or something like that. Consult a dermatologist, take your proper medication, and you can do whatever you want. And yeah, but definitely stress is an aggravating factor for the urticaria.
राइट यही समझने वाली बात है कि अर्टिकेरिया का इलाज संभव है, ट्रीटमेंट ऑप्शंस अवेलेबल है,
Definitely.
और इसके लिए जरूरी है कि हम डॉक्टर के पास जाए. Suffering in silence is not the answer, because definitely it will hamper the quality of life of a person who's suffering from urticaria. So just don't suffer in silence, don't aloof yourself, don't cut off from the society. Just you need to go and consult the right person, which is again a qualified dermatologist in case of urticaria. Many a time, patients with urticaria say or complain that their hives or urticaria get worse during night. What could be the probable cause, doctor?
See, like some urticaria is triggered by some environment or environmental changes like cold or cold or heat or something like that. So it may be related with something like any particular type of food they have taken in the night, like any because sometimes we took certain type of salad or certain type of food in the night. So that must be an aggravating factor for that. But
Mhm.
there are no such kind of thing that we can say कि like particularly night में ही क्यों हो रहा है because once you just need to notice the practice what you are doing at night like आप कोई particularly walk पर जाते हो आप particularly कोई food लेते हो just need to notice such kind of stuff. I think that will help
Right,
to avoid
right.
such kind of stuff.
Okay. Rahul Sharma is here asking, what is your advice for toddlers with urticaria? Because my niece is having urticaria. How to treat that?
For toddlers, it's like first, like I said, कि like we need to figure it out. कि like whenever like अभी कुछ जो भी कुछ दे रहे हैं बेबी को, तो like कुछ उससे कुछ प्रॉब्लम हो रहा है कि after certain food or certain things के बाद कुछ उसको अगर रिएक्शन हो रहा है क्या? And then just consult a doctor because for toddlers it's always consult a doctor. That is quite beneficial, I think, because that is most necessary thing that you can do.
Right. तो टॉडलर्स में तो बिल्कुल भी वक्त जाया नहीं करना चाहिए
Actually,
अगर प्रॉब्लम
actually.
है. Right. So you need to go and consult the right person. Rohit John is here asking, how to treat cold urticaria.
Just taking a cold urticaria comes under the types of the like acute urticaria. So, like I said, it resolves within 6 weeks. Okay, so just consult a dermatologist, take a proper medication. There are many medication the dermatologist can prescribe you, and eventually it will gonna subside. So, see, there are many type of medication that a dermatologist can give you, and that will help a lot. So, it's not like that it will gonna last forever. Just take a proper treatment; it will gonna subside.
Right. So taking the right treatment is important, and for that you need to go to meet the right person, which is again a qualified doctor. And why we are emphasizing so much on the need of going and meeting a qualified dermatologist is because they know our skin best. They have studied, they have spent so much of time, given so much of energy in understanding the skin, etc. So we need to go to the right person. Many times, again, doctor, patients with urticarial condition do complain that they get very tired or fatigued very, quickly or very easily. What's the reason behind that?
It depends what kind of urticaria they are having. So, like tiredness or fatigue, that must be related with the something internal disease. And like I said, like chronic urticaria mostly happens because of the internal disease. So we need to go through the like some history and some detailed investigation, and we can go according to that. That's the that is the that we can go. I think according to that only.
Right. And in last 2.5 years, where we all was under this pandemic called COVID, a lot of people come up to tell that they also had hives on their face after they got COVID positive, and or after recovering from COVID, they got urticaria. So, is there a connection between COVID and hives or urticaria?
It may be or it may be not, because sometimes when we get some kind of viral infection or something. So like I said, like infection also comes under the causes of the urticaria.
Mm-hmm.
So yeah, there may be because of that viral reaction, the viral infection that is going on inside the body. So skin may react in some, and skin may not react in some. See, urticaria is totally it's your autoimmune, like it's your immunity disorder. Whatever your immunity consider, it's an antigen, it's an foreign body to your body that will gonna react to it. So it depends body to like in the immunity to immunity. Like if somebody's immunity is considering it's a foreign body, then it will gonna react to that. So there may be chances. Yes, there may be chances. It's
Okay.
related.
Okay, doctor. And when a person comes to with the urticaria at the very first time, how do you come to the conclusion that, okay, this is urticaria and this may be the cause of urticaria? I mean, how do you diagnose? Is there a test, etc., or by investigations, physical investigation, and history, etc., you come to the conclusion that yeah, it's urticaria?
See, basically, when the patient comes, first thing we do is like detailed history. The detailed history is quite essential to differentiate like it is a chronic or acute urticaria or what is the type of the urticaria. And
Mhm.
and the second, in history, we can also see for the triggering factors, for the precipitating factors. Sometimes the patient comes and they say कि like मैम ये खाने से हुआ है, ये like ये करने से मेरे को काफी ज्यादा ये होने लग गया था. So sometimes the patient also give the history of the triggering factors. And we need to see some any past medical history. So like if the patient is having any autoimmune disorders for the chronic urticaria, this is all about history. And then we can also go for the physical assessment if the patient is having any like lung disease or any liver disease that will lead to the chronic urticaria. Then we can also go for some investigation like serum Ig level, eosinophil level for the increase in urticaria. Then we can also go for CRP, that is C-reactive protein, that is quite increasing for urticarial vasculitis, and some basic tests like liver function test, thyroid test, that will be helpful because like if there is any abnormality in the test, then we can consider it like because of these things which is going on inside the body that are leading towards urticaria.
Okay. And many people, as we also discussed initially, that people are so aware these days. There's so much of information at the distance of a click. Now, the thing is that people are so aware of various allergy tests as well. Many a times, a person who's suffering from urticaria won't go to the doctor first. They'll first go to the lab and, get allergy test done, and then they'll go with the reports to the doctor and say that, see, I'm allergic to 30, 40 food items. So what should I do? Are these allergy tests or so many other tests advisable, or at least what should be the channel? We should first go to the lab or to the doctor. And if the doctor advised, then to the lab, what should be the channel?
If you ask me, I will definitely tell you like go to the doctors because there are many allergy tests. And sometimes there may be chances like when you are having allergy to certain kind of food or certain kind of medication. So like that particular group of medicine or that particular group of food comes positive. So how many things you are going to avoid?
Right.
So it's better to consult a doctor, and otherwise better to consult doctor and then go for the proper treatment. And like I said, like you maintain a diary that will be quite helpful for you. Later on, you can
Right.
go.
So we can, save our energy, our money, our everything by just going through the right channel, which is first you need to go to the doctor. And then if the doctor asks you to get any lab test done, then you can go there. So don't waste your time on home remedies. Don't waste your time on over-the-counter medication. Don't waste your time, energy, money, etc. on consulting a friend or family. Please go and consult a dermatologist. It will save your money, your energy, your time, and your life. Because skin, again, is as it is the largest organ of our body, it's very vital to us. Okay, I'll take few more questions from our viewers. Shivani Gupta is here asking, ma'am, I'm having red, itchy, raised welts on the skin that appears in varying shapes and sizes. So is this a sign of having urticaria?
It may be a sign of urticaria, but we need to examine because there are many more conditions which mimic urticaria, like eczema, insect bite, or something like that. So we
Mhm.
need to examine the lesions, then we can say it is urticaria. But yeah, it may come under the type of the urticaria, like under the urticaria. So, like, is there any other particular symptom you can tell me? Like, then according to that, I will suggest you like what it should be, apart from the
Okay.
ways.
Let's see if Shivani gets back to us with the informations. In the meantime, we'll go to Komal's question. Komal Shakya is asking, what is idiopathic urticaria, doctor?
Idiopathic is something which on which like there are no certain cause जहाँ पे इडियोपैथिक जहाँ पे हमारा कुछ कॉज का नहीं वो पता रहता है और वो बॉडी सडनली रिएक्शन देती है दैट कॉजेस आर कॉल्ड एज लाइक विदाउट कॉजेस दैट इज कॉल्ड एज इडियोपैथिक सो समटाइम्स कैसे होता है पेशेंट आते हैं अर्टिकेरिया के देन बहुत सारी चीजें करने पर ब्लड टेस्ट करने पर एंड देन काफी सारे टाइम के बाद उनका वो लाइक नहीं सबसाइड होता है तो वी कैन गिव दैट टर्म एज एन इडियोपैथिक अर्टिकेरिया कॉज यहाँ पे कॉज ही पता नहीं हो पा रहा है जहाँ पे मेडिसिन से ट्रीट नहीं हो पा रहा है सो दैट इज एन इडियोपैथिक अर्टिकेरिया
Right.
without any cause, we can consider troubling.
Okay. Yashasvi Thakur is here asking, ma'am, my grandmother has urticaria since 3 years. Will it ever be cured? How should it be handled, especially in elderly people?
So she must be having chronic urticaria because it's been 3 years. We need to diagnose it, like how, like what condition that is inside the body that is creating such kind of urticaria. Then according to that, we can treat, and definitely it will gonna cover up. But we need to figure out the cause. That's the most important thing to treat chronic urticaria.
Right. Okay, Monica Sharma, I'm just picking the question, but I think it's a vague one. What treatments can my doctor prescribe? Is her question. But as she has, coined this word treatment, I would like to ask you, doctor, what treatment options do we have in case of both acute and chronic urticaria?
Treatment options. There are many treatment options available for the urticaria. The first line of treatment is antihistamine, but that should be taken on a regular basis, but for a limited period of time. The doctor will examine you and they will give you the according to like for a particular duration of time. Then there are like corticosteroids that are quite effective to prevent the inflammation that's going on inside the body. And there are certain kinds of drugs that is like there is a leukotriene that is a substance that is released during the urticaria. So there is like any other there are medicine that inhibit that leukotriene, and that is called montelukast, and then other medicines are like omalizumab, then cyclophosphamide. There are many medicines that are available for the treatment of urticaria. It's not like that that we have only limited like medicine. There are more.
Right. Is there any dietary precautions or do's and don'ts for patients of urticaria? Though we have, talked about it in bits and pieces, but in case a person who is, who don't know what's causing urticaria, what's causing the allergy, any list of food items, do's or don'ts?
List of food items like I mentioned before, like eggs, milk, then peanut, then chocolates, cakes. These are the like the most common one. Okay, and do's and don'ts like just notice some things like when you take some dairy products or when you are taking some certain kind of food. So like if you are getting such kind of episode, then avoid such kind of food, like avoid dairy product for certain period of time. And then dairy products में भी आप divide कर सकते हो कि या मैंने पनीर लिया तो पनीर से हो रहा है क्या, उसमें भी
Right.
आप cross check कर सकते हो. तो and these are like these are the things I think you can consider.
And many times when people go out to eat, and especially when they eat, things which have a lot of preservatives or colors, like the Chinese food item that we have in our markets, etc. Again, can they trigger urticaria because a lot of preservatives and colors are used?
Definitely, because certain like outside food is like quite common in causing urticaria, and yeah, but everybody's body reacts to like everybody. Somebody's like immunity react to that, and somebody's immunity does not. So, but yeah, it comes under the cause of the urticaria. It triggers.
Okay, so we can avoid these things, or at least be more cautious whenever we are taking them.
Yes.
Okay, so keep making a note. Whatever is bothering you, just list the items so that you'll find a pattern, and that will help your doctor as well to diagnose what could be the probable cause of urticarial condition in you. Rani Aherwar is asking, is urticaria related to stress? Though we have also talked about it, but doctor, can stress lead to urticaria? We have, talked about how a vicious circle it is, right? Urticaria can lead to a lot of stress. That stress can aggravate urticaria, and the thing goes on like that. But can stress lead to urticaria at the very first spot?
Definitely, stress will lead to the urticaria because of stress there are certain hormones that are released in our body, and that hormone will create certain kind of reaction, and because of that, the vasoactive substances are released. That is like histamine that create a lot of create a lot of itching, and that is a like cause of the itching in the urticaria. So definitely, stress is related with not urticaria, with like many other skin diseases. That will increase the hormonal stress hormones in the body.
Okay. Anjali Pawar is asking, is urticaria different from sunburn?
Urticaria different from sunburn? Yeah, definitely. Because see, in some patient, solar urticaria also occurs. Okay, but that is different. Sunburn is totally different because sunburn का जो आपको पैच दिखेगा वो थोड़े लॉन्ग पीरियड तक रहेगा. अर्टिकेरिया का जो भी रहेगा, एक पैच रहेगा या फिर जो भी फील और हाइव आएगा आपको, वो दैट इज लाइक ए ट्रांजिएंट. तो वो कुछ पीरियड ऑफ टाइम के बाद चला जाएगा. लाइक व्हेनेवर यू गो आउट, आपको सन का एक्सपोजर हो रहा है, आपको ये हील आ गया, एंड देन आप थोड़े टाइम के बाद थोड़ा कोल्ड पैड और समथिंग लगा रहे हो तो वो चला गया. बट सनबर्न इज समथिंग विच इज लाइक वो काफी लाइक 7 days 14 days जब तक आप ट्रीटमेंट ना लो तब तक वो थोड़ा सा विजिबल रहता है.
राइट. ओके. अद्विक सिंह है, और अद्विक सिंह जैसे और बहुत सारे हमारे व्यूअर्स हैं जो पूछ रहे हैं वही जिस पर हमने पहले भी बात की कि क्या क्रॉनिक अर्टिकेरिया कंप्लीटली ठीक हो सकता है. नाउ इन एडिशन टू दैट डॉक्टर, बिकॉज ये तो हमने बहुत डिस्कस किया कि क्रॉनिक अर्टिकेरिया क्या है, किस तरह से उसका ट्रीटमेंट होता है, कितना लंबा चल सकता है. द थिंग इज, कई बार एक पेशेंट है जो क्रॉनिक अर्टिकेरिया का ट्रीटमेंट ले रहे हैं, उन्होंने 2 महीने 3 महीने 5 महीने लिया, फिर उनको लग रहा है कि अच्छा अब तो ठीक है, 1-2 महीने से रिकरेंस नहीं हो रहा है, अर्टिकेरिया नहीं हो रहा है मुझे, तो बिना डॉक्टर को बताए वो अपने मेडिकेशंस बंद कर देते हैं, कंसल्ट भी नहीं करते, इन्फॉर्म भी नहीं करते. ठीक है, 2-3 महीने चलता है, फिर से उनको अर्टिकेरिया होने लगता है, तो वो वही प्रिस्क्रिप्शन जो उनके पास पहले रखी होती है उसी से जाके फिर से मेडिकेशन शुरू कर देते हैं. डॉक्टर को इसमें कई बार एक पेशेंट नहीं इन्वॉल्व करना चाहता, और उसकी एक बहुत आसान सी वजह ये है कि बहुत महीनों से हम ले रहे हैं, अब तो ठीक हो ही गया होगा. लेकिन ये जो एक प्रैक्टिस किया जाता है, आई एम श्योर आपके भी कई पेशेंट्स इस तरह से करते होंगे, उनको आप क्या समझाइश देते हैं? इज इट ओके टू डू दिस, और इट कैन एक्चुअली मेक द ट्रीटमेंट इवन मोर लेंथी?
इट इज नॉट ओके टू डू इट कॉज कैसे होता है, जब भी लाइक मेडिकेशन लेते हैं फॉर अ सर्टेन पीरियड ऑफ टाइम, सो ऐसा नहीं कि आज आपने मेडिसिन का कोर्स पूरा कंप्लीट किया एंड सेकंड डे आपने पूरा बंद कर लिया. तुरंत कोई चीज बंद नहीं करनी होती है. ओके, यू हैव टू स्टॉप मेडिसिन ग्रेजुअली. सो वी जस्ट मैनेज द डोज ऑफ द मेडिसिन एंड वी जस्ट मेक श्योर कि हम इसको धीरे 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 कम करेंगे. इट्स नॉट लाइक देन कैसे होता है कि लाइक व्हेन यू स्टॉप मेडिसिन सडनली, तो फिर सडनली आपको वापस से पूरे व्हील्स एंड हाइव्स आने लग जाते हैं. दैट इज नॉट अ गुड थिंग ना, बिकॉज आपने इतने लॉन्ग ड्यूरेशन तक ट्रीटमेंट लिया है. सो जस्ट इट्स लाइक कि थोड़ा सा अच्छे से और मैनेज करके धीरे 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 करके वो डेफिनेटली मेडिसिन कम करके हो जाता है, बट धीरे धीरे, नॉट सडनली.
बिल्कुल, तो धीरे-धीरे, नॉट सडनली, और ये भी आपको आपके डॉक्टर बताएँगे. तो इसलिए गोइंग टू द राइट पर्सन, गोइंग टू द क्वालिफाइड डर्मेटोलॉजिस्ट इज़ वेरी इम्पोर्टेंट, एंड ट्रस्टिंग योर डॉक्टर इज़ अगेन वेरी इम्पोर्टेंट. Now doctor, before we sum up the whole session, any take home message for our viewers?
व्हाट मैसेज?
कोई भी बात जो आखिरी में चलते-चलते आप हमारे व्यूअर्स को बोलना चाहे, जो ध्यान में रखना चाहिए उनको?
Okay. So basically, urticaria is not something which is should be worried about. It's a totally curable disease. Okay, it's a type of allergy. इसलिए वजह से काफी irritating होता है, and because of the pruritus and rashes से काफी irritating लगता है. But the urticaria is nothing to worry about. It is completely curable. Either it's a chronic or it's acute urticaria. It's gonna completely curable. And just notice the thing, if you are having any urticaria, just notice the things कि like किससे aggravate हो रहा है, and avoid that stuff. As simple as that. अगर आपने पता कर लिया, अगर आपको इस चीज से प्रॉब्लम हो रहा है, आपने थोड़ी लिमिटेड चीजों को कम कर दिया, नॉट एवरीथिंग की लाइक डेयरी प्रोडक्ट्स है तो सारे बंद कर दिया, थोड़ी चीजों को भी कम कर दिया, तो आपको मेडिसिन लेने की भी जरूरत नहीं पड़ेगी. बट अगर सपोज कुछ भी साइन होते हैं एनाफिलैक्सिस के और समथिंग लाइक फेस स्वेलिंग और समथिंग, तो डेफिनेटली कंसल्ट अ डॉक्टर. एंड इवन इन अर्टिकेरिया नीड टू कंसल्ट अ डॉक्टर. But that is totally, having an urticaria, that is totally okay because that will gonna subside.
राइट. अच्छा, इसी से एक क्वेश्चन और मैं चलते-चलते डॉक्टर आपसे पूछना चाहूँगी. कई बार होता है, मान लीजिए मुझे अचानक से एग से एलर्जी होने लगी है और अर्टिकेरिया होने लगा है. मुझे समझ में आ गया एग की वजह से हो रहा है, एग ट्रिगर कर रहा है, मैंने एग खाना बंद कर दिया, अवॉइड कर दिया. लेकिन क्या हमेशा के लिए एग अब मुझे बंद करना पड़ेगा, या वापस किसी स्टेज पे शायद मैं शुरू भी कर सकती हूँ? जब आप एज़ अ डॉक्टर ट्रीट करती हैं, तो क्या आप बाद में कोशिश करती हैं फूड आइटम्स को फिर से इंट्रोड्यूस करने की?
इसका ऐसा रहेगा मैम, बिकॉज लाइक अभी आपको सपोज एक से अर्टिकेरिया हो रहा है, ठीक है, तो एक पर्टिकुलर पीरियड ऑफ टाइम के लिए हम स्टॉप कर सकते हैं जब तक आपका ट्रीटमेंट चल रहा है। तो फिर हम जैसे जैसे भी धीरे धीरे हम ग्रेजुअली मेडिसिन जैसे हम कम करते जाएंगे, वापस से हम रीइंट्रोड्यूस करके देखते हैं कि लाइक पेशेंट को वापस से रिएक्शन हो नहीं रहा है उसका, ऐसा लाइक दैट। और समटाइम्स इट हैपेंस कि लाइक जैसे बॉडी में कोई चीज का एलर्जी हो जाता है, तो उसका जो जो मेमोरी सेल्स होते हैं हमारी बॉडी में लाइफ लॉन्ग रहते हैं। That's the most important problem in urticaria, because like suppose अगर if the patient is having allergy to particular kind of substance, तो उसके जो मेमोरी सेल्स होते हैं वो काफी लंबे समय तक रहते हैं। तो एट बेस्ट वी कैन गिव इट अ ट्राई कि लाइक आपको मेडिसिन दे दिया एक पर्टिकुलर पीरियड ऑफ टाइम के बाद, तो सपोज थोड़ा भी अगर उसका सप्रेस हो जाता है जो फॉरेन बॉडी रिस्पॉन्स होता है बॉडी का, तो हम धीरे धीरे करके हम इंट्रोड्यूस कर सकते हैं। बट आई कैन से यू कि लाइक इट मे एक्सेप्ट और इट मे नॉट एक्सेप्ट, इट डिपेंड्स कि आपकी इम्यूनिटी उसको कैसे रिस्पॉन्ड कर रही है।
Okay. Thank you so very much, Dr. Shareefa. It was wonderful talking to you. Thank you for your valuable time. And I'm sure the viewers have got a very good informative session, and they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least now they know that, instead of self-medication, it's always better to approach a nearby dermatologist. It was great to hear you, and we really look forward to many more such sessions in the coming times with you for our viewers. Thank you.
Thank you.
And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.